Hysterectomy. Hysterectomy. It is a surgery to remove the uterus of a woman. The uterus is a hollow muscular organ that feeds the fetus during pregnancy. Terminology: adhesions, scar tissue that can cause tissues to join together. Cervix, lower and narrower end of the uterus organ that contains and nourishes the fetus during pregnancy. Laparoscopy, a procedure performed with the instruments that is less invasive than the conventional technique. Fibroids, tumors that form in the muscle of the uterus. The risks of a hysterectomy are bladder or uterine injury, pain during sexual intercourse, change in the pleasure associated with sexual activity, early menopause if the ovaries are removed, decrease in libido, increased risk of heart disease. Laboratory tests before surgery. Cervical cytology, Papa Nicolau, which detects the presence of abnormal cervical cells or cervical cancer. Endometrial biopsy, which detects abnormal cells in the uterine lining or endometrial cancer. Pelvic ultrasound, which can show the size of uterine fibroids, endometrial polyps, and ovarian cysts. What type of anesthesia can be used in a hysterectomy? The anesthesia used during hysterectomy surgery, whether abdominal, vaginal, or laparoscopy, might be different depending on the technique used by each specialist of the patient's personal condition. General anesthesia. It is an anesthesia that keeps the patient completely asleep and free of pain during surgery. This type of anesthesia can be administered intravenously or via in-throat anesthetic gases. In the case that general anesthesia is used, it will be necessary to intubate the patient to help him with breathing and avoid postoperative problems. By making use of general anesthesia, the surgeon can leave greater control of the patient, avoiding suffering from discomfort, pain, movement of memory of the surgery. Spinal anesthesia with sedation. In this, the anesthesia consists of the administration of drugs in the medullary canal, obtaining the insensibility from the waist down, making the intervention a little more comfortable for the patient. Although in any case the sedation is administered to that she does not remember the surgery and the time goes by faster. Incision. To begin the procedure, a Foley catheter is placed through the urethra to empty the bladder. The catheter remains there during surgery and for a short period. The abdomen and vagina are cleaned with a sterile solution before surgery. To perform the hysterectomy, the surgeon makes a cut in the lower abdomen with one of the following two methods. To perform the hysterectomy in the lower abdomen with one of the following two methods. A vertical incision, a horizontal incision. A vertical incision which starts in the middle of the abdomen and extends from just below the navel to just above the pubic bone. A horizontal incision along the beginning line approximately 1 inch above the pubic bone, closing the wound. With the index finger flexed, the peritoneus is pulled to the interiors to proceed to the fixation and to the edge of the posterior peritoneum, closing the peritoneal hiatus with circlage point or separate points. Post-surgery treatment. Rest a lot. Do not lift anything heavy for 6 full weeks after the operation. Stay active after surgery but avoid strenuous activities of the risk 6 weeks. Wait 6 weeks to resume sexual activity and analgesic for pain. Thank you.